Welcome to Florida Weight Loss and Anti-Aging Center's Medical Weight Loss and Anti-Aging Injectable programs. I am Nurse Tiffany and I will guide you through every step of this process, so please reach out to me if you have any questions or concerns. When you get your medication delivered in your mail, you want to open your package as soon as possible and ensure you received all your supplies. You should have received your prescription medication, syringes, and alcohol pads. In with your prescription, you may notice a pamphlet. You can scan a QR code, and that'll give you the fact sheet of your medication, including the usage and the side effects. Put your medication in the refrigerator and keep it there at all times except for when you are taking your medication. Things to note: your medication is made to withstand warmer temperatures for a length of time, so it is completely normal for your cool pack to be room temperature when you open your package. Your medication will have a beyond use date and a discard date, but do not, I repeat, do not throw out your medication if it exceeds this date. The date is required by clinics that dose multiple clients from the same vial, and we assure you your medication will be good for the length of your program. Just like with any prescriptions from the pharmacy, there are no refunds. Discarded medication cannot be replaced. You will take your medication on the same day of the week, every week, if it is a weekly weight loss injection. For anti-aging medications, you will follow the instructions that were provided to you in your email. Most of them are 3 times a week or twice a week injections, so you will just try to space it out so it meets that criteria. For all of our clients, the medication instructions will be emailed to you, and you're going to follow the instructions provided to you by your email or that was sent for refills in your BodySite messages. Please make sure you have activated your BodySite app so you can communicate with your healthcare and weight loss coach throughout your process. Now we're going to set up for our injections. You're going to place your supplies on a clean, flat surface such as a table or a countertop. You're going to need 1 alcohol pad, a small gauze pad or cotton ball, and a Band-Aid just in case if you have bleeding, but you most likely will not. A solid container to put your sharps in, such as a laundry detergent bottle with a lid, and your medication, as well as a clean, unused syringe. These are single use only, so when you are done with it, it is going to go in your sharps container. Next, you're going to pick an injection site. This is a subcutaneous injection, so it's going into the fat that's located right below your skin surface. You want to do 1 to 2 inches that you can pinch of skin, either around the belly button, the top of the thigh, the lower back love handle area, or the back of the arm if you have help administering your shot. Once you have chosen your injection site, you are going to wash your hands thoroughly with soap and water. You're going to fold back the clothing around your injection site to expose the site. Then you're going to open your alcohol pad, and with firm pressure, you're going to clean the skin around at the injection site and let that air dry. With your dominant hand, you're going to hold your needle like a pen or a dart. This is the motion you want to hold it in. You're going to remove the cap carefully by pulling it straight off. Once the needle cover is off, do not set this syringe down and don't let it touch anything, including your fingers, and definitely do not touch the needle. You're going to draw up the correct amount of medication that was given to you in your instructions that was sent to you by email. Do not follow the instructions that are sent on the package from the pharmacy. Your instructions are tailored to you, and so those are the instructions you're going to follow. To pull up your medication, you are going to be looking at the top of the bevel. That needs to be in line with your unit dose. So if you see 10 units, this is a 100 unit syringe, and it counts by 2s. 2, 4, 6, 8, 10. 10, the top of the bevel is right in line with the 10. 20 units would look like this, and it goes all the way down to 50 units would be the halfway mark, and 100 units is all the way down to the bottom line. If you have received a 50 unit syringe, it's going to look differently. 10 units would be way up here. It'd look a little bit smaller, right? But then 50 units would actually be way down in the bottom, whereas the 100 unit syringe is the 100 weight down at the bottom. So just pay very close attention and make sure it's the top of the bevel, the rubber stopper inside, that is in line with your dose. Giving the wrong amount of medication could cause trouble in your weight loss journey, or it could cause your medication to not last as long as it's supposed to, and it could cause bad side effects if you're jumping to too high of a dose from your previous dose. When withdrawing your medication, I like to first pull the amount of air so I can see it, and then you're going to take your vial. If it's brand new, it'll have a plastic or a metal cap. You're going to take that off and throw it away. If this is your second, third, or longer time going into this vial, you're going to also swab the top of the vial with an alcohol pad. Then you are going to stab your needle directly into the center of the rubber, and you're going to inject the air into the vial, and that keeps the pressure equal inside the vial, so it's easier to withdraw your medication. You're going to slowly pull up the dose that you need, and if you see any air bubbles in there, all you're going to do is you're going to push the medication back in the vial, and you're going to pull back out again slowly. It is normal and perfectly fine to have a tiny air bubble in here. You just do not want to have any large bubbles. If your medication is near the bottom of the vial, you might need to pull your needle out slightly so that you can get every last drop of medication in your vial. You do not want to lose or waste any of your medication. When you're done, you're going to take it out just like that. All right, now it's time to give yourself your injection. Make sure you're still holding the syringe in the middle in a dart-like or pen motion, and you're going to use your free hand to pinch your skin fold at your injection site. You're going to push the whole needle straight down into your skin in one smooth, quick motion. You don't want to go in slowly. It's less painful if you go in quickly. Then you're going to use your thumb or your index finger to slowly push the medication into your skin, keeping the needle in your skin the entire time. I am available for in-person or virtual training assistance if you need help self-administering your medication. I hope you have a great experience with your weight loss or anti-aging injectable program, and please, again, reach out to me if you need me.